first thing we do when a patient calls us and says, help, I've been diagnosed with something I can't even pronounce, much less do I know what to do about it or who to go see. The first thing we do is listen, learn about the patient, listen to, because almost immediately you will hear the kinds of barriers that are up for patients. I'm interested, I don't know how to learn more, I'm having an issue with my clinician, you can learn that very quickly. You also learn what kinds of skills the patient already has inside them. If you've been a school teacher, if you've been a homeless person, if you've been a mother, I mean, you have certain skill sets that are easily transferable to healthcare, but patients always assume it's a foreign country with a foreign language and I'm completely bamboozled. But it doesn't have to be that way because it's not a foreign country and the foreign language is not that hard to learn, and besides there are a lot of interpreters and translators. So really what we do is listen to people, identify the issues, and then help them either find a good care, a good place for their care, pay for, so we also work with financial issues, and then we also help people talk with their employers, because very often what will happen is employers will say, you can take whatever time you need and it's all good, but after about 4 or 5 months of chemotherapy, the employers didn't really know what they were saying, it turns out. And so then that gets awkward and difficult, and sometimes people lose their jobs, and at the very least there's a lot of feelings hurt, a lot of bridges sort of broken. So we help people negotiate right up front with their employers and be very clear about what it's going to take and hopefully keep those relationships intact.